Hello, everyone. My name is Erin Hager, and I am the chair of the Maryland State School Health Council. Welcome to our SHIP conference webinar titled Implementing the WSC Model in Schools to Support Mental Health, What Schools Can Do. So over the next hour, you are going to hear from a number of speakers that will address this topic. And specifically, what we are going to do is give everyone a very brief introduction of the WSC model. So we say WSC all the time, and I realize that not everyone knows what that is. So we'll dig in deep to tell you a little bit about what the model is all about. I will then present just a single slide on the ongoing research onto pediatric mental health concerns stemming from the pandemic. And then you are going to hear the meat of our webinar today, which will be a series of vignettes addressing the main topic of today. So implementing the WSC model in schools to support mental health, what schools can do. And for each set of presenters, so we'll either have one or two presenters for each topic, you will hear their experiences in addressing this specific area of the WSC model as it relates to mental health. Then you're going to hear some general recommendations in addition to recommendations specifically in response to the pandemic. So as we return to school this year, what can schools do to support the mental health of children in each of the 10 areas of the WSC model? And then we're going to wrap up by giving you a little bit of additional information on what's coming after this presentation today, in addition to how to join the Maryland State School Health Council if you are not a member already. So I'm going to start with a high-level overview of the WSC model. So if you are a few minutes into this presentation and really have no idea what we're talking about as far as WSC goes, it stands for Whole School, Whole Community, Whole Child Model. And we use the word WSC, which doesn't really represent what we're talking about very well commonly, and it's usually what many of us refer to this model as. So this is the model in the center, and we'll be showing it throughout the webinar today. This was developed by the Association for Supervision and Curriculum Development, so ASCD, in partnership with the CDC, and it is the recommended wellness framework by the CDC, ASCD, and lots of other health promotion organizations. And so what this does is it integrates the coordinated school health model. So remember, before we used to have 8 components of coordinated school health. Now there are 10 components of the WSC model. And what it did, it took those 8 components and built on them a bit, and then also integrated them with these whole child tenets, which are more widely known by educators. So we're kind of bringing together the school health world and kind of those educational tenets that go into a lot of the specific curriculum development concepts and bringing those two together. And so you can see the intersections between health and academic achievement in a single framework that speaks to educators and health professionals alike. So again, we have these 10 components of the WSC model, and that's what we're going to dig into today. So we have speakers who will talk about each of the 10 components individually as individual vignettes, and how each of these 10 components will relate to child mental health, again, in general and in response to the pandemic. I also want to point out that at the center of this model in the green are these healthy, safe, challenge supported, and engaged tenets of the whole child. These are the core tenets of the whole child, and they are surrounded by the 10 school-based components that support a child-focused vision for health and learning. And then one of my favorite aspects of the model, so I forgot to mention the inner white circle of coordinating policy, process, and practice, and improving learning and improving health. So those are kind of the ultimate goals of this model. And then one of my favorite aspects of the model is that we say that it is hugged by the community. So we really want to emphasize that the community is a big part of this model, so that we're bringing together, again, the whole school, whole community, and whole child together to advance health and academic achievement among children. So you can easily read more about this model on both the ASCD website or the CDC website as well. So now I'm going to pivot a bit to our other kind of main topics. We're going to talk about the WSC model, and we're going to talk today about pediatric mental health concerns. And I'm sure many of you who are watching this webinar are school health experts who work heavily with children stemming from the pandemic. And so this will not be new news to you, but there is a great concern about mental health of children as we return to school post-pandemic. So these are just 2 studies that have recently come out. One that I wanted to mention to you all is a review paper. So it brought together data that had come out soon after the pandemic occurred and lockdowns occurred. So these studies mostly relied on surveys, seeing how kids were doing, asking about changes and things like that over time. But also we've been able to draw as researchers on prior disasters. So disasters that have led to widespread school closures, widespread home-centered lockdowns, things like that, to really understand what the likely impact on mental health of children will be, again, in the long term and in the short term. And so this review paper kind of brought all of those bodies of literature together and identified that we were already seeing an increase in mental health symptoms. We were expecting to see an increase in mental health symptoms based on those prior studies, and that the impacts would be more extreme for vulnerable populations, and they specified children and those from economically disadvantaged families. Again, this is maybe not new news to those of you who work in school health, but it's something that we need to emphasize, that there is science supporting that this is a big concern. To date, there's been one nice longitudinal study in the US that examined mental health concerns of children prior to the pandemic, actually at 2 time points. And then again during the pandemic, and this was about 100 families. I wrote 100, but I'm realizing now it's a little over 100 families. And they found an increase in child mental health symptoms adjusting for maturation. So adjusting for that change and growing up and getting older, which also happens, with kids, they continue to keep growing up and getting older. And they did find that the impact of the pandemic was mitigated to some extent by pre-pandemic self-efficacy. So in this case, the children who reported greater self-efficacy were more protected by the impacts of the pandemic on their mental health outcomes. So again, there is research growing. More and more research is coming out all the time on the impact of the pandemic on child mental health concerns. But that's really why we wanted to address this specific topic for our webinar today. And so you are about to hear our series of vignettes. So again, there will be 10 different vignettes that we recorded at 10 separate times. So we have worked together with our team to kind of splice all of these together so that you will have a really interesting experience of hearing lots of different speakers at lots of different time points. And again, the overall topic you're going to hear about is implementing the WSCC model in schools to support mental health, what schools can do. So enjoy the series of vignettes, and then we'll wrap up with a closing, and we'll tell you a little bit more about where we're headed with this broader project.
My name is Nana Donkor. I'm the Health Education Supervisor in Prince George's County Public Schools in Maryland.
And my name is Leah Jaspers. I'm the Specialist for Health Education at the Maryland State Department of Education. In Maryland, health education is required each year for students in grade pre-K through grade 8. Maryland high schoolers are transitioning from a half credit to a full credit, starting with the class of 2025. Health education includes 6 core concepts and 7 essential skills. One of those 6 core concepts in health education is mental and emotional health. Core concepts related to mental and emotional health include the exploration of emotions and feelings, relationships, self and social awareness, and emphasize health-seeking behaviors related to troublesome feelings of stress, anxiety, depression, or suicide. The goal of mental and emotional health education as part of comprehensive health education is to help young people in the acquisition and the application of knowledge, skills, and attitudes needed to develop healthy identities and personal agency.
As Leah mentioned, one of the former Maryland health education standards was mental and emotional health. And through this unit or this standard, students learned about mental well-being and ways to improve, support, or to seek help for their mental health and that of others. Now that we have moved to skills-based standards, students explore mental and emotional health concepts while practicing essential skills such as accessing valid and reliable information, analyzing influences, interpersonal communication, decision-making, goal-setting, advocacy, and self-management. In relation to mental and emotional health or mental health, students learn ways to communicate and advocate for the mental health needs of themselves and others, as well as ways to locate valid and reliable resources for mental health. Students should receive age-appropriate and grade-level specific health education instruction at every grade level that includes mental health education. Skills-based health education should be provided to students with opportunities for practicing the skills and demonstrating understanding of the skills as they pertain to mental health. In response to the pandemic, teachers have been asked to incorporate skills-based mental health education that emphasizes strategies for healthy coping and self-care, interpersonal communication, empathy, reducing mental health stigma, and finding creative and encouraging students to practice and learn of creative strategies for increasing connectedness during atypical times. They also provide instruction on ways students can locate resources and information that can be shared with families, also school staff, related to understanding the mental health impacts of COVID and strategies for healthy coping and promoting well-being. In Prince George's County Public Schools, I will say that teachers have been more intentional about noticing the mental well-being of their students just by simply asking students how they're feeling and being more considerate of their mental health needs.
It's essential to update health education curriculum to include discussions about COVID-19 and its impact on mental health at the individual and the group level. In an integrated tiered system of support, health education is a baseline or tier 1 intervention supporting student mental health. So an intervention that all students should receive. We're thrilled that the state is transitioning high school students to a full credit of health education. And it's really important that we are teaching health education yearly as required in the foundational pre-K to 8 years to support higher levels of knowledge and skill mastery.
Thank you for listening. We hope you find these recommendations for prioritizing health education to support mental health in your schools.
Good afternoon. I'm Elizabeth Marchetta. I'm the Executive Director of Food and Nutrition Services at Baltimore City Public Schools.
And hi, I'm Erin Hager. I am an associate professor at the University of Maryland School of Medicine, and I chair the State School Health Council. And so we're here today to talk about nutrition, environment, and services and how this is linked to mental health. So as many people know, healthy eating and the ability to secure food and live in a food secure household is linked to positive mental health. And so today we'll be discussing how and why we can prioritize the nutrition environment and those services in order to support student mental health. So again, a healthy diet and food security can contribute to positive mental health. And some ways that schools can prioritize this area is to find innovative ways to deliver meals to students and families who cannot access meal distribution locations. They can provide mental health resource handouts with each meal given at school, or if there is a community distribution site where foods are provided to families, those types of resource handouts can be given then. Or they could equip nutrition services staff with the basic skills to identify youth distress and with the knowledge of how to inform counseling staff when a youth is in distress.
In Baltimore, we supported efforts to get home delivered meals to many of our homebound students during the early COVID pandemic. We also used our existing meal distribution locations as places and hubs to serve other things, from diapers to other sorts of resources or handouts related to the various things that families have depended on school to support pre-pandemic. And then we recognized that our food and nutrition staff, even before the pandemic, might see students up to 4 times a day, and that's every student. So the value of that relationship is extremely important. And we have trained our staff in de-escalation and social emotional learning because we know it is really stressful, no matter what is going on in your life, right when you're hungry and you haven't eaten in a while.
That's great. I love the work that you guys are doing in Baltimore City.
Thanks.
And so now we're going to talk about how we can address the nutrition environment and services in order to promote positive mental health in a response to the pandemic, so during the next school year. So some ways we can do this would be to find innovative ways to deliver meals to students and families who cannot access meal distribution locations. We can provide mental health resource handouts, again, with each meal given at school or at the meal centers. And this, to some extent, will still be going on next year, even though most kids will return to school in person. But there will be times when schools are closed again, as they are every year. And once again, we can equip nutrition services staff with those basic skills that we just discussed in the prior slide.
The transition back from the pandemic will be an adjustment for everyone. And, we need to remember to include our school food services staff in these return to normal activities as we support students and, the full child beyond, the meal. It is really important that as different child health professionals, we come together to support mental health. Thank you very much for joining us.
Hi, everyone. My name is Tamara Mills. I'm Coordinator of Instruction for Worcester County Public Schools. I'm happy to be here.
Hi, and I'm Liz Parker. I'm an assistant professor at the University of Maryland School of Medicine in the Department of Physical Therapy and Rehab Science. As you know, employee wellness is linked to mental health. Studies have been shown that being unhappy with or unfulfilled by work can take a toll on our health, relationships, and even lifespan. Those in unhealthy work environments tend to gain more weight, have more healthcare appointments, and have higher rates of absenteeism. Stress from work can also impact their family life, mental health, and even increase the risk for chronic diseases. On the other hand, participation in organizational wellness programs is associated with higher job satisfaction and lower absenteeism.
So from a public school system perspective, how do we create employee wellness programs that can promote physical and mental health benefits to our staff? The first question is to ask a school is, do they have a wellness program? Do they have the required health and wellness action teams and health and wellness action plans? Every school in the state of Maryland should have those committees and those teams. And essentially, by incorporating the mental health of their employees into those action plans, it ensures that we are really focusing on employee wellness. As Liz mentioned, we know that when students establish and maintain good health, they perform better academically, but the same goes for our staff. If we want top performing teachers and staff members, then we have to help them be their healthiest selves as well. So that includes promoting staff self-care, promoting strategies that reduce stress for teachers outside of the general classroom, and providing them with community resources. So what are some ways, some specific actions that can be taken, particularly once we are now recovering through the pandemic? What can our teachers do? They get a lot of opportunities for things like yoga and mindfulness, and those things are incredibly helpful, but it's really important also to ask your staff what they want. That's a really big, important piece. A lot of times I hear from teachers and staff members at schools that essentially they're given a lot of opportunities, but they're not necessarily strategies for health and mental health that they would prefer to take part in. So one of the big keys that you see here on the slide is essentially a mental health needs assessment. It's really important because that really becomes the basis of what you then do for the rest of your school year or the rest of your, working year. You can create community directories, and that allows teachers and staff to go out and seek the help they're looking for specifically. We have folks in our district, particularly our coordinator of school health, who has gone to local businesses and organizations for discounts and opportunities that are strictly for school-based staff. We offer things that just help make them feel better about themselves, like clean water refilling stations. But it's really, and also we touch base with our insurance company to find out what kind of health benefits they can provide for free or little cost to the staff. So again, it goes back to really focusing on our staff needs and what they need to mentally be healthy.
So thank you for listening, and we hope that you find these recommendations helpful in prioritizing employee wellness to support mental health in your schools.
Hi, my name is Evan Vellman. I'm the Dean of Student Wholeness and School Counselor at Elmer A. Henderson, a Johns Hopkins partnership school. And as we all know, social and emotional climate is vital to mental health. We'll be talking about today how you can prioritize social and emotional climate in your school buildings. So a positive climate, social and emotional school climate, promotes well-being, not just for the school community, but also for individuals. We have a couple examples listed here, which include co-teaching social and emotional lessons with mental health staff who are stationed in your building, as well as providing small group experiences for students to address specific social and emotional learning needs. A few things that we do at Henderson Hopkins in this way that I think are really positive is that we have dedicated time for social and emotional learning during our school day, where everybody in the building, pre-K through 8, is learning from an evidence-based curriculum. This provides us opportunity to push in as school counselors, as social workers, as school psychologists, our extended mental health providers, into those lessons to collaborate with teachers. We actually find here that teachers really can take on a lot of ownership of social and emotional learning, but often can get stuck or really need that content area expertise. And so that's why having your mental health specialists in school who know this work inside and out, join teachers and co-teach with them is really, really helpful. Providing that expertise for a teacher to turn to in a moment of doubt or even just a moment of question. A student may bring something up in class where the teacher might not know the answer, might not want to give an answer because they don't want to go down the wrong road. And having somebody there who can give a confident, guiding answer can be a really helpful strategy. Some other suggested actions here to integrate mental health, specifically in response to the pandemic. Something that is not just valuable in schools, but in families as well, is to promote an open dialogue about talking about the pandemic. Not just about how you and your family or your school or your classroom was impacted, but how a variety of people in our country and our world have been impacted, and how folks are responding to the pandemic. It's a moment of openness, not a moment to avoid. Another strategy here is to bring in healthy coping and self-care strategies into the classroom. And point 2 and point 3 here are really, one is in an SEL classroom, but the other is really just in general during your school day. And I think this is really, really important, that we have to teach our students and staff how to care for themselves in a meaningful way, how to cope with stressful situations. And we have to specifically teach those strategies. We can't just assume that folks know how to take care of themselves. We have to be very strategic and intentional about what skills we teach and how we teach them. But then you also have to do the work of integrating those skills that are learned throughout the school day. So it's not enough just to teach somebody how to do it, but you have to let them practice it. So we really encourage folks to use mindful moments, brain breaks, even in your morning meeting. If you're a K-8 school, we have dedicated time in our schedule here at Henderson Hopkins for 15 minutes at the beginning of the day. And we dedicate that time to morning meeting and the traditional things of morning meeting, getting prepared for the day. In our lower grades, knowing what day of the week it is, knowing the date, all those sorts of things, talking about weather, right? All those traditional things that you do during morning meeting, but also integrating a self-care, coping strategy, a breathing skill, an emotional check-in. There are a lot of ways to do it, but you really have to be intentional and purposeful across your school building. You can't just allow people the option of doing it. You really need to make sure that it's happening. Put specific time in the school day teach specific skills, and then give time to practice those skills. Thanks for listening. And I hope you find these recommendations are helpful in prioritizing social and emotional climate to support mental health in your schools.
Hello, I'm Krista Carlson, Healthy School Communities Coordinator for Maryland SNAP-Ed. As you know, the physical environment links to mental health. An environment that is thoughtfully designed to attend to the physical and emotional needs of children provides a sense of stability and care. We will be discussing how and why the physical environment should be prioritized in schools to support mental health. A safe environment contributes to mental health and promotes physical health. But beyond basic safety, the physical environment can provide built-in opportunities to nurture students' well-being. Classrooms can be set up to allow space for physical movement breaks, provide adequate personal space, and offer spaces for de-escalation and calming. Common areas throughout the school can nudge students to move their bodies and encourage mindfulness. This might include movement hallways with signage cueing physical activity, or other visual reminders to enjoy a mindful breath or a stretch. Outdoor spaces, including gardens and play areas, are ideal for reflection, calming, and exploration. Ensure these spaces are maintained for safety, provide clear sight lines, and include clear rules for use. Student artwork and visual nudges for movement and reflection can boost the value of these restorative spaces. As part of the response by schools to the pandemic, schools should be proactive in sharing information about how the physical environment has been adapted to address health and safety concerns. This can reduce uncertainty and anxiety that contribute to mental health concerns. While physical distancing requirements remain in place, schools should be creative in prioritizing time and space for social connection and engagement, even within those constraints. Outdoor spaces may be a particular asset in these efforts. Additionally, fresh paint and kid-centered decor can make schools as welcoming as possible, even in the midst of restrictions, and help students manage stress. Thank you for listening, and we hope you find these recommendations helpful in prioritizing the physical environment to support mental health in your schools.
Hi, I'm Debbie Somerville, the Coordinator of Health Services for Baltimore County Public Schools.
And hi, I'm Kate Connor. I'm a pediatrician from Johns Hopkins and the medical director of our school health program, the Rails Health Center. Debbie and I are going to talk today about the WISC component health services. And health services are absolutely related to mental health because mental health and physical health are inextricably linked. We know that they impact one another, and we know that they both impact utilization of health care, both inside and outside of the school. So for some brief framing, school health services is the idea of how schools provide core health services to all of their students. So this is sometimes called school nursing and ideally is delivered by school nurses. This encompasses not just sick or injured kids walking into the health suite on a daily basis, but also integrated wraparound services like preparation of IEPs and 504 plans and wellness services within the school. Some schools, in addition to school health services and school nurses, have an augmentation called a school-based health center. And this is essentially like a pediatric clinic inside a school where there's a clinician on site who's available to take referrals from the school nurse as well as direct visits in order to provide acute and preventive care for students right there in the school building.
So, as Dr. Connor said, mental health concerns often, if not usually, impact physical health. And really that direction is both ways. School health services staff cannot operate in silos. They must establish collaborative frameworks both within the school and in the community to effectively support student health, physical, mental health, and other aspects of children's health. Within the school, it's essential that school health services staff establish formal and informal linkages with school teams and other mental health providers to ensure coordinated care and case management for students who have special needs. In addition, school health services staff must establish connections with families and healthcare providers to support students' mental health. For example, there was a recent study that looked at suicide rates among students with ADHD and who had externalizing behaviors. And that study showed that students who were actively taking their ADHD meds were less likely to complete a suicide. So that connection between mental health and physical health could not be overstated. Identification of students with mental health concerns in the health suite or school-based health center can be directly observed and sometimes need to be drawn from data. So sometimes our students will come into the health suite and really let us know right directly that they're feeling very anxious or sad. But at other times, we really notice that there is or may be a health concern because the child is somaticizing and perhaps visiting too much, or perhaps being absent. And in those calls to a family to determine the reason for an absence, we identify the need for mental health supports. Visits to the health suite and the school-based health center are also a great opportunity for screening as well as brief mental health interventions. It's critical that school health services staff receive professional learning on the various screening tools and evidence-based brief interventions like motivational interviewing that they can use as part of their practice.
So we all are acutely aware of the extent to which the experience of the pandemic over the last year and a half has significantly impacted the mental health of adults, children, and communities. And it also has really highlighted the critical importance of school health infrastructure and adequate funding and support and collaboration for school health services, as well as school-based health centers and communities that need them. And that's because these trusted sources of somatic healthcare are often a critical linkage between schools and students and families and mental health services, particularly if there's, for example, a stigma related to mental health, accessing mental health services. The school nurse is a friendly and trusted individual who kids and families can go to, who may be able to identify issues and refer students. So in response to the pandemic, it's particularly important that the collaboration that Debbie talked about be really strong, and that the school nurse, school health services staff, and school-based health center staff where they exist are really brought into talking about the approach to identifying and addressing mental health concerns among students, particularly as more and more return to school after the pandemic. And it's going to be even more important as part of that strategy and that approach to have some universal strategies for identifying kids who may have previously unidentified mental health concerns, such as screenings. The other thing that's really important is that we promote access even for students who aren't inside of school buildings. And that means figuring out ways that school health services providers, school nurses, and school-based health centers are able to reach students not physically in the building, often through telehealth or other technology-based solutions. So we appreciate you taking the time to listen to this discussion of the critical role of health services in supporting student mental health.
Greetings. I'm Nancy Lever, and I'm a clinical psychologist and an associate professor at the University of Maryland School of Medicine. I co-direct the National Center for School Mental Health, which focuses on advancing school mental health policies and programs at the school, district, state, and national level.
Hello, and I'm Derek Simmons. I was formerly the Director of Student Services for Caroline County Public Schools and recently named the Interim Superintendent for Caroline County.
Within the WISC model, counseling, psychological, and social services refer to prevention and intervention services to support student mental health. Services include a broad array of assessments, referrals to school-based and community supports and services, and counseling and consultation. Mental health identification and referral are critical components. School staff and teachers in particular are often the first adults to recognize mental health concerns in students. Offering professional development for teachers and school staff on mental health identification and referral, and also having mental health screening and assessment processes available can help to ensure that students with mental health needs are identified and given the supports that they need. Providing mental health services in schools should build on the foundation of student instructional support personnel, such as school social workers, school psychologists, to include community partners in order to provide a fuller array of services and supports. In the words of our colleagues at the National Association of School Psychologists, when it comes to school employed and community partners supporting school mental health, it is not either or, it is both and. When partnering around mental health services in schools, it's important for families, youth, and school staff to be aware of available services and supports, and for there to be clear policy and procedures on how to make a referral and how to have a coordinated system of care. Let's now hear from Dr. Simmons about his superintendent perspective.
Thank you, Nancy. Each school system and district is unique, and as is its community. Each of us has a different set of tools and resources that are readily available to us, both internally and externally. And it's important that each school harness those resources from within and also build those community partnerships in order to strengthen their access for services for their students. Additionally, these partnerships, when put together well, also help to increase staff understanding and staff professional development related to mental health concerns to strengthen support for students within the building.
Students and staff mental health have been greatly impacted during the pandemic, particularly related to increased rates of depression and anxiety. With more students likely to need mental health services and supports, increasing mental health awareness efforts and strengthening school district capacity to provide Tier 1 and Tier 2 services will be essential. Telehealth and use of virtual platforms have been essential for providing care during the pandemic, and lessons have been learned about how to better use technology to improve communication and collaboration with youth and families. As we wrap up this school year and move into the next, we need to figure out how to use what we have learned to build back even better systems. Let's now turn to Dr. Simmons, who will share practical examples from his district.
Thank you again, Nancy. The pandemic has opened our eyes really to examining this opportunity from a different lens than one we saw before. The bringing of devices into student hands as we move to a one-to-one district has really opened up the opportunity to access those mental health services that we did not have access to previously. As we return and bring students back to the building, it's important that school systems harness this opportunity with in-person providers, as well as those who are available to reach out to our students through community MOUs and partnerships to provide those services. Additionally, it's equally as important that we create that school environment as students come in, again, working through our partners, that eliminates the stigma associated with those seeking mental health support and building that positive system that we hope to be in place that supports all of our students and their needs for accessing any of their health services.
Thank you, Dr. Simmons, and to our participants, thank you for listening, and we hope that you find these counseling, psychological, and social service recommendations helpful in prioritizing mental health in your schools.
Hello, everyone. My name is Erin Hager, and I am faculty at the University of Maryland School of Medicine, and I chair the Maryland State School Health Council. And I'm going to be talking today about community involvement as it relates to child mental health in general and during the pandemic. And so we know that community involvement leads to a broader array of mental health services and supports that might be available to children in schools. And a huge part of the WSC model has to do with community. It surrounds the model, it's embedded in the model, and we talk about it a lot. And we've definitely learned in the pandemic that community partners have really been willing to get involved, have been active partners in a lot of different efforts in schools. And so we would hope that when we start talking about how we can address mental health needs of students, again, in general and during the pandemic, that our community partners would be right there with us side by side so that we can really support our students in helping them with what they need. So some example actions in general might be to invite community partners to participate on a school mental health task force or different awareness campaigns just to increase the, again, awareness that mental health concerns are a part of life for many, many, many children and adults. And that these are things that we can work together to address in schools. Another thing that could be done for schools in general would be to develop an MOU with community mental health providers to increase the access for students to the different types of services and supports that might be available in the community. And so I know a lot of different LEAs have community partners that work in the mental health field that have been vetted by the school system. And so for schools to kind of find out who those partners are, how they can access those resources for their students would be a really important aspect as well. And keep in mind throughout this entire webinar today, we're not just talking about students who have are experiencing a serious mental health crisis, or students who have symptoms of depression or anxiety, but maybe it's students who who've just seen a bit of a change in their current mental health state and are at a higher risk for heading down a road of depression. And so whatever we can do to prevent a mental health crisis, but also address it in schools, is really essential, and community members and community partners are really a big part of that for many LEAs. And so as far as suggested actions go for the response to the pandemic, it could be that schools work with the community to develop a directory of available mental health supports for students and families in schools and in the communities. Sometimes when a parent needs a resource for their child, they just don't know where to go. And clearly schools are a trusted partner. And so if there is a list, a directory of sorts of different resources that are available, that could be a great support for families. There could be a town hall or a resource fair that's hosted by the school, either in person or virtual, where different available mental health resources and supports could be promoted. This would clearly provide resources for families, but also normalize that this is a big part of life for a lot of individuals. Again, like we said before, consider establishing MOUs with community practitioners to expand those availability of services and supports. Again, now more than ever, this could be really essential as we respond to the pandemic. And then finally, strategizing with community partners, the different ways to increase mental health services and supports to students who may need them right away. I know a lot of mental health providers are experiencing huge volumes of patients right now. And so ensuring that our students in our schools also have access to these providers in different formats, whether it be in person, hybrid, or virtual, could be really essential as we return from the pandemic. And so that is our vignette specifically focusing on community involvement. And again, community partners are such a key part of all of our school health efforts that including them in this effort as well is really, really essential. So thank you for listening.
Hello, my name is Ann Gaddis. I'm the Director of Public Policy with the Maryland Coalition of Families. Like most of our staff at the Coalition, I'm the parent of a child who experienced significant mental health issues, and so I bring lived experience to discussions about practices and policies regarding children's mental health. Family engagement is a key component of student mental health. Just as a student's academic success can be linked to family engagement in their schools, their child's school and education, so too is a student's mental health strengthened when families are engaged in their child's social and emotional development. Many studies have shown that a family's engagement in mental health supports produce better outcomes in children, both for those who are experiencing mental health struggles and those who are not. Therefore, to best support the mental health of students in schools, families must be engaged in the process. Families oftentimes need information about social emotional development in children and youth and strategies to promote good mental health. Schools can be a conduit to pass on relevant information to families. This can be done in materials sent home or in webinars and presentations offered to families. Since there is abundant evidence that more students than ever are struggling with mental health issues owing to the pandemic, many parents who previously may not have been interested will be eager to learn more about promoting positive mental health and what to do if they think their child has mental health needs. As always, the more that the ideas and preferences of families are solicited, the more likely any health initiative has of being successful. Sometimes families do not recognize the mental health problems that may be developing in their child. This was the case with my family. It was only when the school reached out to us and suggested that my son appeared to be experiencing troubling symptoms and recommended that we consult with our pediatrician that we became aware of the extent of the problem. In turn, it was our pediatrician who recommended that we seek a mental health consultation. Our son's school played a key role in our ability to help our child. It's not only students, but also caregivers whose mental health may have been negatively impacted by COVID. Any attempts to engage families in promoting good mental health in a child must recognize that the caregivers too may be struggling. Therefore, school activities that have been designed to promote good mental health should be mindful of the needs of both families and children. In addition, an important strategy to promote the engagement of families is to offer activities and services virtually. Webinars, as opposed to in-person presentations, allow more families to participate. Activities that can be done virtually will hold greater appeal to many families. It is imperative that families continue to be given the option of participating in the delivery of any school-based mental health treatment via telehealth. We know that the mental health treatment outcomes of children improve greatly when their families are engaged, but often it is a tremendous burden for a caregiver to meet in person with a school mental health provider or to participate in their child's treatment in person. Telehealth allows for much improved family involvement. Finally, families should participate in all levels of planning regarding what mental health services and supports are needed within the school. For example, recently in Maryland, the state superintendent led an initiative to develop regional mental health crisis teams across schools in the wake of the COVID-19 pandemic. Families were asked to participate in the planning meetings and to present on their family's experience with mental health crisis services. The more family perspectives that can be brought to inform planning, the better. Focus groups, surveys, and school forums all can serve to solicit the ideas of families. School mental health services and supports will be more successful with buy-in from families, and the best way to achieve buy-in, and therefore family engagement, is to solicit people's opinions and design services and supports in alignment with what families want. The success of various programs should be regularly evaluated with input from families and adjusted accordingly. Thank you for listening. I hope that you found these suggestions helpful in prioritizing the support of mental health in your schools.
Hello, I'm Cara Grant with Montgomery County Public Schools, Maryland, the largest school district in Maryland, 14th in the country, and I am the pre-K through 12 supervisor for health and physical education and adapted physical education.
And hello, my name is Nick Thompson. I work for Wycomico County Schools as the supervisor of physical education, health, family and consumer sciences, and we are on the Eastern Shore of Maryland. As you know, physical education and physical activity is linked to mental health. In Wycomico County recently, we studied over 4 years of data that showed the relationship between how students perform in academics in school related to physical activity. We will be discussing how and why physical activity and physical education can be prioritized in schools to support mental health.
As you can see on the slide provided, physical education and physical activity are integrally linked to help students with their mental and emotional health. Physical movement, moving the body, helps the brain and helps mental and emotional health tremendously. How can we prioritize this to let students know, one, to receive the instruction, a standards-based instruction in physical education and health education, to let them know that this is what is important and how the mind links with the body movement. We have some system-wide examples in Montgomery County Public Schools through the Be Well 365 program, where we use the WSCC model and really coordinate efforts with other groups on that model, like school psychologists, school counselors, providing students with physical education as the goal of getting them the education they need so that, one, they can physically move through the day, but two, that they can connect the improvement to mental and emotional health.
And in the next slide, we will be discussing how physical education and physical activity is prioritized to integrate mental health and during the response to the pandemic. Suggested actions to integrate mental health in response to the pandemic. First, we discussed we offer standards-based physical education programs that is equivalent or greater than what was offered during the pandemic. Provide physical activity opportunities that students can engage with family members virtually outside of school hours and in the community.
And really what we're talking about is thinking through and creating new ways and processes for students to engage in physical movement post-pandemic, as well as continuing successful implementation of a physical education program standards-based. So what we are doing is creating summer opportunities for physical movement that are free for our students in Montgomery County Public Schools. We help link them up with pay-to-play models in their community through the Parks and Recs program, highlight parks in local areas, and even the playground at their school so that they can use in the summer. The field space that is at their school in the summer, getting out to go to the swimming pool, go fishing, do other kinds of activities where they're physically moving as they engage in summer, as well as during downtime after school. But during school, we focus on coordinating school efforts with MTSS, which is the multiple tier supports and systems. Physical education is a tier 1 support because every student is receiving physical education in their pre-K through 12 career. In some districts in Maryland, they're receiving this annually, pre-K through 8, they're receiving it annually. And then in high school, they have the opportunity to receive it annually if they elect to have PE electives through the course of their freshman through senior year. Our non-diploma bound students also receive this as well. The tier 2 and tier 3 really come into like coordinating efforts with mentoring programs based with physical activity, intramurals, athletics, that students can link into, as well as more systemic approaches around psychologists and counselors, linking and coordinating efforts for wraparound services. The goal truly is to put physical education and physical activity first because it is critical in providing students with instruction on how to move and how to link and understand that moving helps your mental and emotional health.
In summary, continue to advocate for physical education and physical activity in your schools and your community, and be cognizant of the efforts that all staff in the schools can put to this to improve the health and well-being of all students and staff. Thank you for listening, and we hope you find these recommendations helpful in prioritizing physical activity, physical education to support mental health in your schools.
Okay, now we are going to wrap up now that you've listened to all 10 vignettes that are focused on different aspects of the WSC model in relation to child health, both in general and, child mental health, both in general and in response to the pandemic. So where are we going with this broader project? So this is actually an initiative that our State School Health Council started about 7 or 8 months ago. I think it started prior at the end of 2020, where we decided that we really wanted to focus on a product this school year, something that tangible that we could provide to our partners, both in Maryland and throughout the country, that might be useful as we all recover from the pandemic. And so we actually wrote an academic paper. And so the paper is currently under review. And so once that is available, we will certainly promote it and share it with our partners. But then from that paper, we decided to take this, this academic product and transition it into this presentation in a way that would be potentially digestible by lots of different audiences. So what we've decided to do is take this entire hour-long presentation and load it to our State School Health Council website. In addition, we are going to keep those individually recorded 3 to 5 minute vignettes that we pulled together with all 10 components and have those posted individually. So if there was one specific idea that you heard today or one specific speaker that you wanted others to hear from, you could share the link with them, but specifically tell them, be sure to listen to family engagement. That's the one that I think we really need to listen to. Listen to the nutrition environment topic, whatever it is that you think that would be really, really particularly of interest to your school or your LEA. You can just listen to that one. So you don't have to listen to the whole hour all over again or have your colleague listen to the entire hour. So that is our plan. It is not available as I'm recording this, obviously, but hopefully we will get those loaded quickly. If you need access and they are not available yet on our website, please reach out by email and we will certainly follow up with you. In addition, we are working with some partners at the Johns Hopkins Consortium for School-Based Health Solutions to develop handouts that will be easy to read, one-pagers, kind of outlining those different areas that we talked about today. They'll be bright and colorful and again, easily translatable to the school level. So all of the content that you heard today in the presentation form will be available in these easy to read one-pagers, also loaded to our website, and I assume the consortium as well. So they've been wonderful partners in this larger project. So more to come on that, and hopefully all of these products will be available by the end of the summer at the latest, so that they're prepared by the start of the school year. And so I just wanted to wrap up by letting you know a little bit about the State School Health Council in case you are not a current member. We would love for you to join. I'll start by just letting you know our mission. So our mission is to promote health for the whole child. So again, very relevant to the WSC model. Through health promoting programs and policies and providing leadership and support to local school health councils and state and local agencies. And this is a legislated entity. This is something that is required to be in place in Maryland. And the legislation part specifies that it must be a partnership between the State Department of Education, the State Department of Health, and our local education agencies. However, over the years, we have certainly expanded to include our partners in nonprofit private schools, residential childcare institutions, in schools directly, so not just working with the school system, but also working with schools in Maryland. And then we've brought in a lot of different partner agencies, and those agencies have really been really very helpful and in moving our mission forward. And I say that as someone who is a member of a partner agency, since I'm at the University of Maryland School of Medicine and not specifically affiliated with one of these other groups. But that partnership that we've created has really been very helpful. And again, moving our mission forward. So I'll just tell you briefly that we know it's been around a long time. We tried to look back to find out a little bit about what the origin story for the Maryland State School Health Council, and all we know is that it was formally reorganized in 1966, which means it was clearly around before that. The purpose that was specified in this document that we found in a basement in a building in Annapolis was that it was to assist in the development and maintenance of school health programs and promote effective and comprehensive school health programs. The first time I shared this information a few years ago, we joked that this document talked a lot about infectious disease like tuberculosis and other health issues that schools were facing. Clearly, obesity and other chronic health concerns were not as highly addressed in this document. And at the time, infectious disease was not as big of a concern among school health practitioners as it clearly is during a global pandemic. So things have changed a lot in the past few years as we now think more about infectious disease again. This document did say that the council studies, plans, and recommends action aimed at identifying health needs and remediation health programs for school-age children. And it's basically a forum for the departments of education and health, local partners, and other groups. Just like I was saying, all those partners who are at the table, the State School Health Council is meant to be an entity that brings all of those groups together. We are structured so that we have an executive committee that is composed of a chair, and I am the current chair of the State School Health Council. We have 2 vice chairs. Those vice chairs are meant to, between the chair and then the 2 vice chairs, the 3 individuals who are leading that executive committee are, it's specified in our bylaws that they represent, one represents the State Department of Ed, one represents the State Department of Health, and then one represents another agency. And so again, I'm with the University of Maryland School of Medicine, and that is my other agency that I represent. And so that we want to have a balance of power in those 3 positions so that the different agencies are represented. And then we also have a secretary and treasurer. Current secretary and treasurer is Christy Corona, who is absolutely fantastic and has really been instrumental in helping to move so much of our work forward. And she works with me at the University of Maryland School of Medicine. We have an executive board of invited members. Currently, we have 32 members. We are always looking to expand to include other school health council representatives from our LEAs. So if this is something you might be interested in, please let us know, and we can discuss the role of the executive board more in depth. Essentially, we meet every other month and really choose different goals for each school year to move things forward. And then finally, our general body is currently composed of 220 members. Essentially, it's just getting on a listserv. So if you are not part of our State School Health Council general body and you would like to become a member, I'll tell you how to do that in the next slide or two, but all are welcome to join. You will get emails about the SHIP conference, emails about webinars, and different types of emails. Again, I'll tell you more about in a minute, and you can always opt out of those emails. So generally, again, what we do with those emails that the general body gets, we focused on 3 topic areas, and these topics came from listening sessions that we held in 2018, and these are areas that we're still working on today. So we currently partner with the University of Maryland Carey School of Law very closely. Past couple of years, they've been fantastic partners for our State School Health Council. And as part of what they already were doing prior to partnering with us, they provide weekly legislative updates on school health issues. So I know that there are lots of different agencies that provide school bills specifically, but these are really about school health. So if you're interested in digging a little bit deeper into those concerns around youth health in general, they talk about other tobacco legislation and healthy eating and physical activity legislation in addition to schools, but one of the tabs on their Excel sheet has to do with schools, and I just find that really, really helpful. And then they're also willing to provide support for our local school health councils. So if you are invited to to testify or to comment on a bill and you're nervous or don't know where to begin, our partners in the Carey School of Law are happily there for you. It's part of their mission and what they hope to do. We provide opportunities for networking. We have done in-person meetings at SHIP that were fantastic, or we actually only had one in 2019. And then of course, we met virtually last year and again this year, hoping to be in person again one day with all of our group together. And we give out an annual award for school wellness promotion that will be given out this year at our first webinar in the fall. And that brings me to communication. We do host bi-monthly webinars on lots of different topics. All of our webinars are recorded and they are shared on our website if you want to find out more about those topics. And then starting this year, we really have been focused on generating products that would be helpful for our for our local school health council members, and also really broadening the visibility of the great work that's happening in Maryland. So those academic papers can help with that, but also from those initial kind of topics that we bring together through an academic product, we can then create guides or reports or one-pagers and those types of things that may be helpful. And so finally, how to join our State School Health Council, you can visit our website, which is listed here. We also have a Gmail account that you can email directly to get on our distribution list. Again, we would love for everyone to be a part of the general body. If you are really interested in learning more about the executive board and participating in that, we are happy to have a discussion with you and find out more about your interests. But we are looking for greater representation of our different LEAs and partners at the system level, but others are welcome as well. So we definitely love to have that conversation. So we hope that you took away some great information around what you can do to support mental health among the students in your schools, starting in this fall, especially in response to the pandemic. We hope you learned something new today. And we hope that you will be able to visit our website and share some of the information that you learned today with others in your LEA or school. And if you have any questions, please reach out to us. We are available for any further discussion you would like to have. So thank you again for listening and have a wonderful day.